Taoiseach, I want to put it to you this morning that parents of children with special needs simply face too many barriers and obstacles to accessing services, from school placements to respite, to proper and timely assessments, to basic equipment and aids to help their children get through the daily tasks of life. It's extraordinary the number of children, for example, that are waiting for appropriate assessment in terms of occupational therapy assessment. Nationally, 4,640 children are waiting more than a year for their first OT assessment. That's despite the Disability Act of 2005 saying 3 months is the statutory requirement. In Cork alone and Kerry, which have the worst, you have well over 1,700, way above that period waiting for assessment on occupational therapy. There are up to 60 children in one school waiting for, are on a waiting list. No special school placement available to them. We have 14,000 waiting for speech and language assessment. We have no certainty, and parents are facing terrible anxiety. The therapy services, as you know, Taoiseach, are critical. The assessment is critical, and then the access to services subsequently is critical for children. In terms of OT, for example, we're talking about children with conditions such as cerebral palsy, the dyspraxia, spina bifida. And I think it's a shocking indictment of what's going on and the lack of prioritisation of this particular area. As I say, other areas, you take respite. For about over 2 years, there was up to 30 parents waiting for a weekend respite. Nothing. Because the disability organisation, because of cuts to its money, had to literally put in a chronological dividing line. But that got resolved only last week when we had to bring the parents' representatives up to meet the Minister for Disabilities, or Special Needs, Finney McGrath. But those parents were without respite for up to 2 to 3 years. Parents of children with severe and profound autism. It shouldn't have to take that length of time and a meeting, the dynamic of a meeting, to kick the system into action to provide for them. Last week I met parents of a young child with muscular dystrophy. There's an extraordinary Taoiseach rationing and medieval bureaucratic system around application for aids and appliances. I'm talking about wheelchairs, specialist footwear for a child with muscular dystrophy, or particular bodysuits that prevent scoliosis or other complications arising. So I would put it to Taoiseach that a fundamental and comprehensive look needs to be taken at timely access for such services for children. And the mindset and the attitude has to change, and the barriers have to be taken down. Because if you talk to parents of children with special needs, they're still saying they're facing too many barriers, huge stress and huge anxiety.
Taoiseach.
Well, I agree that this is a matter that has been looked at over the years, and obviously the government have adopted the findings of the report carried out by Eamon Stack in respect of access to services for children with intellectual challenges at schools, which will eliminate many of the problems that have been around for a long time. The HSE is currently engaged in a reconfiguration of the existing therapy resources that are available to teams spread geographically for children from birth to 18 years. And the objective of that model of assessment, as the Deputy is aware, is to provide a single, clear referral pathway for all children, irrespective of the disability that they might have, where they live or whatever school that they attend, in order to streamline this. Obviously, evidence from the areas will show that implementation of that programme will have a positive impact, and it's taken quite a while to get to this. In regard to respite that Deputy Martin mentioned, HSE and the agencies that it funds provide respite care to children with adults and disabilities. Clearly there are challenges here. Respite can occur, as aware, in a variety of settings for any length of time, depending on the needs of the family and the resources that are available. It's not always centre-based, and it can be provided in a number of ways. For instance, out of home, in home, home to home, home support, family support. And as a part of the continuum of services for families, respite helps prevent out-of-home placements preserves the family unit and supports family stability. So while the situation that the Deputy outlines is not as satisfactory as one would wish here, let me say that the HSE is very much aware of the importance of the provision of respite for families of both children and adults with disabilities, including the impact of the absence of respite service provision that can have on other services. It does not necessarily cease, obviously, once a person reaches the age of 18, but that depends upon the availability of resources. And obviously, as a result of the number of the respite beds that are being utilised for long-term residential placements, the numbers of people with disabilities in receipt of residential respite services and the corresponding number of respite nights are down against previous activity because of that. And that reflects, if you like, new models of respite care that are now being delivered to home respite or extended daycare, etc. Though what the Deputy raises is an important consideration, particularly for the families and for the young people involved. But it does depend upon the availability of trained staff and resources.
Thank you, Taoiseach.
And that's why the structure has changed, and hopefully over time will be far more streamlined to deliver a more effective service.
Deputy Martin.
Taoiseach, the bottom line is it's simply not working. It can be a case of a young child, 2.5 years, needs assessment application within in June of 2016. Was told it would be dealt with on the 23rd of September. Was then told in November by an assessment officer that there was a 5-month delay. She was processing number 482. This child was number 981. Eventually got a private assessment to be told that an ASD unit, early ASD unit, cannot be made available because it must be a HSE assessment. These are the kind of cases that deputies are picking up across the country, Taoiseach. Long waits for assessment and an inability to access services. Marion House, for example, would be the autism centre for assessment in South Lee. In a letter last year, admittedly sent, the last paragraph kind of reads, currently in Marion House there are only 8 whole-time equivalent posts to 770 children. This scarce resource is divided to 3 teams to support children from time of diagnosis. The situation is out of control. We're sorry we're unable to offer a comprehensive service which you and your child deserve and require.
Thank you, Deputy.
That is a story across areas of the country, Taoiseach. 801 area waiting for autism assessment. I could go on, but Taoiseach, it's not working. No point in talking about models. Urgent intervention is required, and it shouldn't have to be deputation after deputation going to ministers to get these issues resolved. There has to be a comprehensive dealing of the issues.
Obviously, you're aware of the very close collaboration between the health and education sectors and on children's disabilities in general, and that's facilitated by the cross-sectoral team on the implementation of the Disability Act. And that comprises representatives of health, education skills, children and youth affairs, health service executive, National Council for Special Education and the NEPS service. And they've been established to progress specific cases. I might say to you that the full implementation of the Progressing Disability Services programme is expected before the end of this year. €8 million in additional funding was invested in 2014-2015 to fund 200 additional posts to deal with the backlog that Deputy Martin refers to, and a further €4 million in additional funding was provided for 75 therapy posts in 2016. It's expected that the reconfiguration of those services will have a significant impact. In 2013, there were 260 prioritised frontline primary care posts. That included 52 occupational therapists, 52 speech and language therapists, and the aim was to address the waiting list that you referred to.
Thank you, Taoiseach.
In 2016, Cancora, €4 million provided under the HSE's National Service Plan to focus specifically on speech and language therapy waiting lists in primary and social care for children up to 18 years of age, and that investment represents a long-term investment in speech and language capacity that will be maintained through this year and for the years ahead.